the next assessment criteria states the personal safety benefits of undertaking dynamic risk assessments. Well, look, I mean, we're pretty much on the subject, right? That's what I've just been covering, and saying think about in advance the situation. So, I mean, you go again, 3 years, 4 years, 5 years, 10 years, 20 years, how long have you been working in the industry? Have you not used a dynamic risk assessment before? I'm sure you have. I mean, it's ideal. It's not only ideal because it allows you to assess or analyze a risk before getting involved. It also allows you to account after the situation as to why you took the action that you did. So in short, a dynamic risk assessment is a method or a process of analysing the risk and the best course of action to take prior to the action, then during the action, and then after the incident as well. And of course, it increases our own ability to assess and react to the changing situations better. So I like the old school version, okay? The old version acronym, they call it SAFER, and it's quite appropriate really, isn't it? SAFER. So what does that mean? Okay, so imagine you get to a situation, okay, and you see it going on. Are you running straight in first, or are you assessing what's going on? So you kind of psychologically take a step back. So that's S, step back. So you psychologically step back while you do what? What are you looking at? You're observing, aren't you? Or you're assessing, A, assess, S-A. How are you going to assess a threat? Okay, well, we'll look at another acronym called POP, P-O-P. So what does that stand for? People, objects, and places. So as you assess a threat, you first of all look at the people. You think about who you're dealing with. Do you know them? How big are they? Have they got any history? Are they drunk? All these types of things you need to consider before even getting involved. The O is for objects. What's around them? Are they holding a weapon? Are they holding a gun? Are they holding a knife? Are they holding something that can injure you or something around there? And again, just is that going to affect how you deal with the situation? Whether you would go up and deal with it? Yeah, of course it would. So think about that. So P for people, O for objects. Are they holding anything? And the other P is place. Where is it taking place? Are they in a dark corner? Are they out of sight of CCTV? Are you secluded? Things to thinking that if things did go wrong, have you got an exit route? Have you got an escape strategy? So once you've done that, you psychologically step back where you've assessed the threat using POP, person, object, place. You're now going to think of F. What could F be? Find help. That's right. Find help. Can I deal with the situation on my own, or do I need backup? Okay, and now I'm thinking of that, and yeah, I'm doing backup, so radio backup, and now I'm Ian. I'm Ian. What does E stand for? Evaluate. I'm evaluating my options, and it's at this point where like 100 things or 1,000 things are running through my head. And this is the beauty of the human brain and how well it can think, because what I'm now thinking, right, if I say this and he does this, this is what I'm going to do. If he says that and he says that, then this is what I'm going to do. And if I say that and he says that, then I'm going to say this. And if I say that, he's likely going to say this. And then if he says that, I'm going to say that. It'd be confusing, but it is what it is, isn't it? And as you know, with years of experience, you kind of almost can predict, or you have like a library of things that you're going to say and then they're going to say. So when you say it, it's likely they're going to say that, and when they say that, you have something to say back to them. So by thinking this stuff in advance and evaluating your options means that when you do R, which is respond, you can kind of predict the outcome, and that's what we're looking for. If we can predict the outcome, we can choose our response. Whereas if we're surprised by the outcome, we've got to think on the spot, and thinking on the spot isn't so great. Okay, so that's the dynamic risk assessment. What is it again? S, step back, while we A, assess a threat, and we do that by P, people, O, objects, and P, place, where it's taken place. We think F, which is to find help, do it on our own, do we need backup? E, evaluate our options, and then R, respond. And of course, when we respond, what would we now be doing? Of course, continuously going back to the re-evaluation process. The next assessment criteria, which is listing ways to minimize personal safety at work. Okay, so ways to minimize risk to you would be things like good communication, good customer care, good customer service, isn't it? So choose your words correctly and use choice speech. Okay, so as I said before, rather than telling someone you're going to get physical with them, which you could well be within your rights within the law to do so, it may be better to offer the inhibitor of the police. I'll get the police involved, I'll get colleagues involved, our core control room, etc., etc. Okay, so good communication is key in order to minimizing dangers to yourself. Follow instructions for any particular task that may involve any additional risks, and then of course, if that involves wearing personal protective equipment, for example, you're working at a building site, then of course you must make sure you do that. So as part of your role, you may need to perform manual handling. And if you are involved in manual handling, it's important that you follow simple steps to ensure you do it as safe as possible. So when we look at the definition of manual handling, it's a movement or support of any load by physical effort, including lifting, moving, carrying, pushing, and pulling. If you don't manual handle correct, you could end up with lots of types of injuries, things like fractures, spinal disc injuries, trapped nerves, damage to muscles, ligaments, tendons, etc. You get the idea. So when it comes to manual handling, we need to keep in mind the following. Okay, so the first thing you should do is stop and think. So don't go to move it right away. First of all, think, does it actually need to be moved? And if it does need to be moved, where does it need to be moved to? So think about the direction of travel. Also think whether you can actually lift it yourself or whether you need assistance, and that can either be another person or it could be some type of machinery to lift. But let's say that you can lift it yourself, but you don't need anybody else, and you know the direction of travel, etc., where you want to take it. So first of all is positioning the feet, and of course you position the feet about shoulder width apart. Then when it comes to actually doing the lifting, you bend at the knees and you keep your back straight, don't you? Or ever so slightly faced. So you bend at the knees, get yourself a firm grip, keep the load close to your body, and as you lift up through your knees and not your back, keep the load close to your body, and away you go.